right, so there's a bit of an issue I want to talk about, and essentially what's happening is that we have DOGE here, and Elon is heading it, and he's trying to weed out waste and corruption. The problem with that is that there's actually a much bigger issue right beneath the surface that I don't think he's actually going to be able to touch. And at the end, he's going to end up being a sad DOGE. And if you don't know what DOGE is, essentially it's the Department of Government Efficiency, and what he's trying to do is he's trying to go in and he's trying to reduce the budget, because right now we're running in a huge excess of the amount of money that we take in. And these numbers are becoming so big, there's actually a threat that we're going to be unseated as the reserve currency of the world, which means that we could have the threat of hyperinflation. And this is kind of like in Europe, where people are literally having wheelbarrows full of money that they would have to exchange for a loaf of bread. Or when you're literally setting your money on fire because it's more useful for that than trying to use it as currency to buy firewood. So what is the underlying issue, and why do I think DOGE is not really going to make as big of a dent as Elon thinks it will? Let's start with the government income. So the first thing that we want to look at is how much money is the government taking in? So far this year, the government has taken in, and this is the fiscal year, so this starts in October, the government has taken in 1.6 trillion in revenue. This basically comes from a variety of sources, but most commonly it's from individual income taxes, so that's what you pay, payroll taxes, which is what your employer pays to the government on behalf of you, and then corporate income taxes. And that's essentially just the taxes that the company pays in general. So not in accordance with payroll. And then also minorly, it collects revenue from admission into national parks and things like that. So in 2024, the federal government collected 4.92 trillion. So that number is going to be important when we go into the next slides. And again, the primary source of that revenue is from individual income taxes. So that's the taxes that you and I pay on money that we make. And if you're looking at this graph on the right, you can see basically the trend line, taxes have been going up. So there have been more and more and more taxes collected over the years because the 5-year trend line is below the current trajectory and last year's numbers. So the issue that I want to illustrate, and this is the big problem, is that in the fiscal year 2025, so again, since October, the federal government has spent $2.44 trillion. And again, if you compare that to how much they've brought in so far, you're running essentially 800 billion of a difference. So they're spending 800 billion more than what they're taking in. And there's a variety of programs that they're funding with this. And I'll go into a few more of those as we continue along here. But just the thing that I want to illustrate is how much more we are spending than what we're taking in. And so again, if we're going to compare it, same thing, apples to apples. Last year, so 2024, the government spent 6.75 trillion, and when you compare that, they only took in 4.92 trillion. So just easy math, we're almost 2 trillion in deficit spending each year. And that's borrowing, right? It's either borrowing or they're printing. And again, looking at the graph on the right over here, you can see the spending, the 5-year average is below as well, much like the previous slide. The 5-year average is also below the spending lines. So just further calling out exactly what I'm talking about here, the amount by which the spending exceeds revenue is 840 billion so far this year, and that's only since October. As I mentioned, this is deficit spending. So they're spending more money than we're taking in. And again, the exact number for 2024, the deficit spending was 1.83 trillion, so almost $2 trillion more than it collected, resulting in a deficit. And just last year alone, when comparing it to 2023, the national deficit increased by 138 billion. So when you're looking at this, And again, the numbers are going to look, if you're looking at the graph on the right here, the numbers are going to look a little bit different because we're not completely through the year yet. So our line for this year is going to be off, but you can see on the right of the graph, each of the years tell an interesting story, right? So we had 2021, which was still in the pandemic when things were shut down. So the amount of revenue that was coming in was significantly less, and the spending was the highest it has been since then. And that makes sense, right? So you're going to have the larger deficit. But then 2022, 2023, 2024, we're still in huge amounts of deficit for each of these years. And that's a concerning trend, because if you think about the amount of money that Elon is saying that he's been able to save us, which on the DOGE.gov website, if you go check it, he's said that he's been able to save $61 billion. And again, it's still early days, right? It's only been a couple of weeks. So that's not awful, but putting this up here, if he's saving us essentially $60 billion so far, and he's already made a run at USAID, he's been looking into certain areas, but the issue is he's going to have to cut so much more to get this down. And again, I'll continue to illustrate the challenge with this. So a total breakdown of where is this money going? When you look at this graph, you can see that 27% of it, or 1.9 trillion, went to healthcare, Medicaid, Medicare, ACA, marketplace. So that's individuals that just go out and get their own healthcare, veteran hospital, medical care, global health, and other health spending. 21% of it goes to Social Security. 13% of it goes to national defense. Net interest comes out to 13% as well. Income security is 11%, and other is 15%. So the best way to illustrate what I think is the biggest issue on this is that total government income only pays for Social Security, Medicare, Medicaid, and food stamps. And the biggest problem is, what do you cut from each one of these? These are safety nets for people that need it. Now, just in case you're not 100% certain what each of these programs is, I just want to do a real quick overview of how each one of these serves the community. So the first one I'll cover is Medicare, and at a very high level, Medicare is a health insurance program for people that are age 65 and older. It covers some other groups as well, like people under 65 with disabilities, but the primary purpose of it is to cover people who are older. The next one is Medicaid. Medicaid provides health coverage to millions of Americans, and really it kind of focuses on low-income adults, children, pregnant women, and then also there's some overlap where it also covers elderly adults and some people with disabilities. So again, just a very high level of what is Medicaid. And then Social Security. Social Security at a very high level is benefits for retirees. So this is, when someone hits 65 years old, they retire. This is what they get for all the years that they've worked. And in theory that they have been paying into the system, but it's not really operated future looking, right? So when you're paying into it, it's not to build up a fund that when you hit the age, it's just, this is the amount that I've paid in, this is the amount I'm getting back. What it is, it's kind of like a Ponzi scheme. I don't want to call it that because it's a welfare program, right? But in that the people who are retired today are just taking the money from the people who are paying into it as it's being paid in. So it's, again, not like they have some huge amount of money sitting out there where when you hit it, it's going to be available. It could go away at any time, because if there's too many people, and this is kind of the issue that we're running into now, and if you hear experts talk about it, there's too many people drawing from it versus paying into it. As an example, when it was first created and utilized, there were in this country 33 workers to one recipient of Social Security. But as the population has aged and started collecting on it, what has happened now is that it's one for every one person on Social Security, there are only 3 people paying into it, which is obviously becoming an issue. So the way that it has been working is not really going to work into the future. And what's the problem with that? So at the current rate, Social Security will run out of money in 2033. And when it does, every single person on Social Security gets 20 to 25 less in their payments. Now, I don't know about you, but that seems like it might be kind of an issue, especially when there's been rampant inflation and trying to reduce. I mean, just think about your salary, right? And what you do with the money that you make. Imagine making 25% less. And again, this is not huge amounts of money that they're already making. I think this essentially will just devastate, especially people who have been working, low wage or more minimum wage jobs their entire working career. They really depend on this money. So it's the people who have the least amount that have the most to lose by this happening. So there's one other part that I want to talk about that I've kind of left out of the equation, but I think is another big one when you're looking at that pie chart that I had put on previously. And that's the military. So how much does the US spend on the military? So since 1980, defense spending has risen by 62%. And at that time it was at $506 billion, and now it's at $820 billion. And that's even an old number. It's actually went up even more last year, and they're looking at increasing it again this year. And this is just a really quick breakdown of where that money is going. So as you can see here, the Air Force is the largest recipient at $216 billion. The Navy is the next largest at $202 billion. The Army follows from there at $165. And after that, it falls off pretty precipitously. But as you can see, there are still billions of dollars for each group, and these numbers just keep climbing. All right, this I thought was kind of interesting. So if you're looking at this graph, you can see here just how much we're spending on each one of these. So the top line on the graph, which is the dark blue one, is Social Security. That is by far and away the largest expenditure that we have. And again, that's money for retirees. The next highest, and it actually just surpassed military spending, is Medicare. So again, that's healthcare for retirees. The next highest is military, and they don't actually directly call it out, but the line underneath that is actually payments on the interest of our deficit. So our deficit has become so large that repaying those debts has actually become the fourth largest expenditure in our ledger. And if you're actually looking at this graph, you'll see the rate at which it's increasing is rising so precipitously that it will actually be the leading cost on the US ledger. So it will surpass the national security, defense spending, it will surpass Medicare, it will surpass Social Security in 5 years if we continue spending and increasing the budget the way that we have been. And if you look at how much we're spending on our military, if you compare it to the next largest countries, we're over 3 times China's spend, which kind of makes sense because if you think about it from my tariffs video, the problem with that is that they can create things for much less expense than we can. So I feel like that's part of the reason why they have been increasing the budget so much. And it feels like kind of a panic-driven increase, is that they're saying, okay, China is spending this much, so we have to spend X amount more to outpace them. And again, if you're able to spend 1/10 the amount and get the same results, then yeah, we don't want them to become more technologically advanced. But if you compare it to our allies and people who have equally expensive costs to produce these types of equipment, you'd see that Russia, Saudi Arabia, the UK, Germany, Ukraine. So if you were to actually combine, and this is including China, the next 9 highest spending on the military, that would be the same cost as the United States. So we spend an astronomical amount on our military. So let's dive into the solutions that I think are the best for each of these. First is slash and burn. This one essentially applies to the military, in my opinion. And the statistic that I think is really interesting, there are over 1,000 active duty U.S. troops serving overseas as of March 2024. And the U.S. military oversees more than 27 million acres globally through its military bases. So if you do look at this map, you can see there's pretty much military presence everywhere. There's almost literally not a single place in the world where we do not have troops. And if you're thinking about you're paying for gear and equipment there, you're paying salaries there, these costs just add up and become astronomical. So much so that military spending is over 13% of our budget. Do we really need to have presences in all of these places? Yes, there can be an argument made for global security, but in a lot of instances, I think we actually do more to destabilize than we do to keep peace. The next point that I want to make is that of personal fraud. The first instance I want to bring up was that of Medicaid fraud. And there's essentially a woman in this example who she was a behavioral health clinician. So what she did in this scam was she essentially stated that she was treating patients and then she would in turn charge the government for Medicaid reimbursement of the services that she said that she had provided. And the problem with this is that she was saying that she served people that she had never even treated, and in a single week in March of 2023, she submitted 96 claims, which means that she would have had to have worked 12 hours of in-person psychotherapy per day. And in that week, she collected over $9,000 from those claims. However, it was later discovered that she actually was on a vacation that week at Disney World, and she got found out by making multiple social media posts about the vacation. And in fact, she had actually submitted more than 17,000 false claims. So we're looking at the totality of all the claims that she had submitted, and that amount of money that she was taking from Medicaid was $1.6 million. And the craziest thing about this is that she also claimed that she was unemployed and collected $41,000 in unemployment benefits from the state of Connecticut, where she would have to submit certifications that she had not performed any work, and she denied that she was self-employed. So again, she made $1.6 million claiming that she was providing psychotherapy while she was also collecting unemployment. The next case that I want to cover focuses in on Medicare, and this one's a little bit larger. This was for $54 million. And the craziest thing about this to me is that he has to pay $34 million in restitution. However, he made $54 million. So what happened to that other $20 million? But what he would do is he would essentially prescribe durable medical equipment and cancer genetic testing without seeing, speaking to, or otherwise treating patients. And this is extremely common. So what people will do is that they will essentially say, hey, if you come in and say that I extracted a tooth, or in this example, I got cancer genetic testing. If you come in and sign that we did that for you, you'll get a free toaster or something, right? And the issue with that is that then they're going out and they're filing these claims that we did all this testing, or we did these minor procedures, or we did whatever it is. We got devices for these people, and then they'll get reimbursed for it, and they never actually did the work. So much so in this instance that he was awarded or submitted and reimbursed $54 million. And there's so many of them as well, where essentially it's like you get a free scooter, right? And then the submission for that is, okay, we did all these things. It's the same thing. It's a scam. So they basically claim that they did all these other steps and they're getting reimbursement for all of it. And in the end, they give you a free scooter because the cost of that scooter is a drop in the bucket compared to how much money they're making from reimbursements from Medicare. And then another huge issue, still in the healthcare industry, is that of systemic corporate fraud. And what that looks like is, and there's been a lot of it recently, is when companies just ramp up prices. They essentially form a monopoly, they buy up all of a certain thing, and then they charge astronomically higher prices than what they were charging previously. Think about this like insulin, right? That was in the news recently. So the best example of this, though, and this happened again very recently with drugs like semaglutide, right? Whereas originally it was created for individuals with type 2 diabetes. There was a huge rush for it. Companies realized, oh, hey, supply and demand, it's become so popular for weight loss now that we can just jack up the prices. And what they did was when this did get super popular, they said, okay, while there's a shortage, we can increase the price. And then they never brought the prices down. They just continued to increase them because the demand was so high. Even though it's artificial price increases, they just realized, hey, people are willing to pay for this now that it's a weight loss drug instead of I need this to control my type 2 diabetes. And so what actually happened was the total price went up by 364% from $7.7 billion in 2019 to $35.8 billion in 2023. And that's purely from Medicare Part D. So I think the knee-jerk reaction would be, well, yeah, of course, it got more popular and people wanted to buy it to lose weight. But no, this is specifically people who are using it out of medical necessity. And in fact, if you're looking at the same time period and you're taking a look at the amount of enrollees, that number only grew 12%. So it's kind of a joke when you're looking at it and you're saying, okay, the amount of people who have entered into Medicare Part D is only 12%, but the amount spent by Medicare Part D is increased 364%. And this is 100% just these companies that own all the drugs realizing that they can gouge Medicare on the cost of these drugs, which leads into my solution, right? So I was outlining the problem with the health system, but what are we actually going to do with it? And I think it's get rid of the for-profit model. And it's very easy to see how this doesn't work at all for us. Essentially, these companies are coming in, whether they're private or they're corporately held, and they're essentially creating monopolies. They're snatching up all the hospitals. They're buying up all the drugs. Each one of these is becoming an area where private equity or savvy individuals come in and they go, oh yeah, look, you can make a profit here because this is something people need. It's a non-negotiable. If you get sick, you need to go in and get treated. If you break a bone, you need to go into a hospital. And that's the thing that a lot of corporations are doing, is they say, what are the things that are necessity to living and how can we extract the maximum amount of profit out of those? Because people need those things to survive. And this is one instance where it's had awful outcomes. So to further illustrate that example, let's take a look at how much we are spending per person in the United States. And when you look at this, in 2022, the average person has $12,555 spent on them. That is over $4,000 more than the next highest country, which is Switzerland, which they have social health care. And compared to the average of other countries that are most similar to the US, that's almost over double. So if you look at that and you say, well, surely then we must be the most healthy. No, absolutely not. The life expectancy in the US is actually 4.1 years shorter than the average of comparable countries. So before, when I was saying we're spending twice as much almost, well, we also have a shorter life expectancy. And the thing that's particularly concerning to me, if you're looking at this graph, is that in the COVID years, we actually spiked down much greater than the average. Yes, the average went down because people got COVID and people, especially who are older, passed away earlier. But the problem is that we lost, in comparison to that, an additional 4 years, whereas the average throughout the rest of the world was only a 1 year reduction, if that. So when I'm looking at it, what that says to me is that not only are we less healthy than the rest of the world, but the problem is actually significantly worse than even those numbers tell us. Because with the number dragging that much further down, that means that these numbers are influenced by people who are morbidly obese and just generally unhealthy. Because the fact is that people who are unhealthy were more adversely impacted than just being old. So if you were morbidly obese and older, you were more likely to be impacted by COVID-19. And because the number dipped down so low, that means that we have even more people who are morbidly obese than these numbers even accurately project. And just to back that up, so the US, although it's not the highest, it is in the top 10. And when you compare it to other countries who are relatively similar, we're actually the leader. And this graph only illustrates up until 2016. So you can imagine the number has just continued to grow and grow and grow. But even in 2016, about 38% of the United States was obese. And when you have numbers with that, it's not surprising at all why when COVID came through, it especially ravaged the United States, because a greater proportion of our population is obese than any of the other countries who are similar to us. And we know for a fact that obesity and old age were the two leading indicators of if you were going to pass away from COVID-19. But let's talk a little bit more about the profit motive ruining the American healthcare system. And this is another older article. It's from 2014. But even then, I think it illustrates a very relative point. And that is that the 5 largest health insurance companies, which at the time were WellPoint, United Health, Aetna, Humana, and Cigna, earned over $3.3 billion in profits between April and June of 2011. So that's literally 3 months. And when you're looking at this, and this is, I thought was another interesting statistic, but in 2012, the Mayo Clinic, which is a leading hospital, the CEO of the Mayo Clinic made around $2 million a year, which is a lot. But the CEO of Blue Cross Blue Shield, again, an insurance agency of Illinois, so just the Illinois, a not quote unquote nonprofit insurance company, made $16 million. So again, these companies are just incredibly greedy. And at the end of the day, it's just snakes fighting snakes. And what happens is the consumer is the one who can push back the least. So these outcomes, these negative outcomes, get pushed down all the way down the ladder until we get hit. And that just seems to be happening over and over. And again, further illustrating that point, America's largest health insurers have raked in more than $371 billion in profits since the passage of the Affordable Care Act. And more than 40% of that net income went to United Health Group, whose annual profits have skyrocketed by nearly 400%. And this got a lot of play in the news recently when their CEO was assassinated. But when you're looking at these numbers, and I've talked to friends and family members about it, but my take on it is that I'm actually surprised that something didn't happen sooner, because it's just insane healthcare greed. In fact, the average American family's premiums have risen to nearly $26,000 a year. Again, this is one of those fields where I think we just need to get greedy corporatists out of the picture completely, because the issue with this is the very top leaders of these companies are looking to make as much money as possible. And you can't do that in an industry where people's lives and health are on the line. So what do I think should happen here? I think I've laid it out pretty easily, but in summation, I think we need to just radically slash the military. Yes, we need to have a strong military, but when you look at how much we're spending versus the next country or the next 9 countries, it's just insane how much money that we're putting into it. And to have a presence all around the globe, and for what? Also, I hope that I've painted a pretty good picture, and I think DOGE is doing an okay job with this, of going after fraud and waste and abuse, which obviously there's quite a bit in Medicaid and Medicare. But at the end of the day, that's only going to make so much money. Because when you're looking at it, and if you look back at the stories that I covered, the waste and abuse was millions. Granted, with many people doing it, it adds up, right? And so we still need to 100% go after that. But when you actually look at the biggest issues, it's that greedy companies are coming in and taking advantage of something that is non-negotiable. People have to have health care. When you get sick, when you break a bone, you have to go in and get taken care of. These are literally just companies taking advantage of that fact, buying up and consolidating power, and then taking advantage of the public. And obviously, not a huge fan. It's a little bit unsettling that the government would have to regulate something like that. But honestly, I think it's the only solution because there are no actual controls on monopoly power. Nobody's actually going after these companies for taking advantage, and it's happening so frequently, I don't even know that it's possible. So the government, in my opinion, just has to come in, take it over, and run it. Because again, otherwise, these companies just all end up fighting each other trying to make the most profit possible. And also to tie that back around into my original point is, once again, that of scale. Just like the Medicare and Medicaid fraud versus the for-profit model where we're talking millions to billions and trillions. Same thing with DOGE, where we're talking about billions of dollars of cuts, where we need to be talking about trillions. Because otherwise, the budget will just continue to grow. There will continue to be more and more deficit until the US dollar spectacularly flames out and brings all of us along with it. Anyway, I hope you found this interesting. If you have thoughts on the matter or any other solutions that you think I might have missed, feel free to drop it down in the comments. I'd love to see what your thoughts are on the matter. If you've made it this far, it would really help the channel if you could leave a subscription. That way you know when I have new videos come out. And again, thanks for watching, and I'll see you in the next one.